Healthcare Leadership and Nurturing Excellence Summit 2026. Now is the time for panel discussion 3. As we returned from lunch, we shifted focus from vision to execution, from design to delivery. Our next panel examines a function that quickly determines efficiency, quality, and trust in healthcare systems, reimagining healthcare procurement and supply ecosystem, driving efficiency, transparency, and strategic value for a future-ready India. Let us begin panel discussion 3. I invite Mr. Naveen Sharma, Sir, Facility Director, Fortis Shalimar Bagh, to moderate this session. Now I would like to call on stage all the panelists. Vijay Kumar Gupta, CEO, Raipur, LED, Chip Industry Private Limited, Hospital Lighting. Vikas Goyal, Head Supply Chain Management, Fortis Memorial Institute. Nandini Gokal, Procurement Representative, Fortis Healthcare Limited. Rakesh Agarwal, Health Central Buying, Care Hospital Quantity Care India Limited. गेस्ट हैं सबके लिए एक जोरदार तालियां हो जाए.
Good afternoon, Namaskar. I think although all sessions were very good, but this session pertains to the conference or the exhibition which is going on. The exhibitors which are there, they have their targeted audience are sitting here. As and when the healthcare transformation has been discussed, the first visible thing which comes up is doctors, infrastructure, the outcome. All these are the visible things. But there are few things which are behind this. What are those? What is the success of this good healthcare infrastructures? What is the success of these clinicians? Behind every ICU bed which gives life, behind every scan which enables the diagnosis, behind every service in hospital, there is a very quiet, complex and credible ecosystem which works. And that ecosystem is procurement, that ecosystem is supply chain management. Yesterday when award function was going on, and we had awarded a lot of clinicians here, hospitals. So I was just thinking, sitting there, what is the success of these clinicians? Who is behind them? There is a team. And in team there are a lot of unsung heroes are also there. And these unsung heroes are, out of the team, I'm picking up one. Today we have supply chain management and our topic pertaining to them. They never come in front. They work in silos at the back, supporting the complete system, supporting the CFO or the CEO of the organization to get their numbers, to help the doctors, clinicians, nurses to actually go for the service. So today we are going to discuss about supply chain management. We are going to discuss about the procurement. Are we going to discuss about the traditional way of the procurement, or we are going, as the topic suggests, beyond how the tech is going to help us, how the new systems are going to work out, how it is going to helpful in the shaping up the country, leading the world. So I have very renowned and experienced healthcare leaders with me who are part of our panel. I'll start with their introduction, starting from my extreme right, Mrs. Nandini Gokhale. She is the AVP Supply Chain Management for Fortis Healthcare. Quite a long experience she have managing a big chain of hospitals, their supply chain management systems. So we are going to have a lot of learning from her. We have Mr. Rakesh Agarwal, who is heading the supply chain management of Care Group of Hospitals, another chain which is fast growing. So there are a lot of learnings from Rakesh, which we are going to have. We have Mr. Vikas Goyal. Mr. Vikas Goyal heads the supply chain of Fortis Gurugram Hospital. How in a fast-growing hospital, the innovation and efficiency has to be maintained. So we are going to learn from Vikas on this. And we have Mr. Vijay Kumar Gupta, who is the founder and CEO of Raipur Lead Chip Indus Private Limited. Lot more from a manufacturing perspective, from an infectious disease products. In my earlier panel, there was a discussion about how we are going to work on the preventive. So we are going to learn from him on this. I believe that this session is going to be very interesting. So I'll start my discussion with Nandini.
Yeah. Hi, good afternoon, everyone. And it's glad to be here. And thank you for having me.
You
on
need
this
to
stage.
take the mic up.
Oh, I said good afternoon, everyone, and thank you for having me here. Yes.
So hospitals have invested heavily in technology these days. The groups have invested heavily in terms of the ERP systems, automation and analytics platform. So I'll start from that thing, that which digital initiatives which you think had delivered in a real time, miserables, rather than in terms of the presentations, yes, this is the technology which has worked out. So I wanted to start up the discussion rather than going in a traditional way that how the procurement or for a group level it works out. We'll start with the technology. So what's your view on that?
Yeah. So I just want to go back a little bit here because I speak about Fortis Healthcare. And in Fortis, we started our ERP journey way back in 2010. And at that point in time, everybody said it was too early to launch into an ERP because our healthcare environment is not ready for such heavy investment, number one, or capability in terms of the way market is seeing healthcare today. But irrespective, Fortis went ahead with the ERP journey, and 15 years later, we are on ERP. We have had advancements in our existing ERPs, which actually now we can see, not at that point in time, but today there are a lot of things which help us, which have helped us because of this implementation, which we had, let's say, started 15 years back. So I think the basic measurables which we have are the foundational, the digital initiatives, not the very advanced ones. I'll go into that. But like spend visibility is one of them, where you have detailed analysis of what kind of spend is there. You're able to standardize your workflows because you have a robust ERP system. So, and your master data management, because the entire ERP actually lies on how good your data is or how you manage your workflows. So that has been very helpful. So ERP has helped in that. The other things are like your auto replenishment, your price variations, where you can actually track variation. It can help reduce that variation. But I think where ERP has not gone to that level is actually meeting the expectations of a healthcare system or a healthcare deliverable. Because traditionally ERPs are built for manufacturing industries, and healthcare is a very vast area and it has a lot of variables. So I think there we need lot more investment and time to go into it. I think the second thing is the time required for any healthcare chain to actually adapt to that kind of ERP. So that is also one thing where I think the ERPs need to gear themselves up so that we can go into it. And I think the third area is AI. AI is an upcoming one, but other industries have caught up much early. I think healthcare is a little behind. I can talk of hospitals. I know pharma industries and all could be there, but as a hospital industry, we are a little behind on the AI journey.
Thank you, Nandini. In fact, you had taken us into a different kind of a scenario, a lot of people understand in terms of the procurement just that there is a discussion with the suppliers and it has been done. But where you had expressed, where you had explained in terms of the use of the technology, in terms of innovations, that's pretty interesting. Rakesh, there is a concept which has been widely discussed, total cost ownership. Although there is a lot of discussion is on this, everybody thinks that this is the new concept, everybody has to implement. How challenging you feel in terms of actually executing it at the hospital operations?
Thank you for the question, and thank you for the Medgate to arrange this session. And it's a insightful session, and thanks to the audience bearing us post-lunch. And coming to your question, sir, TCO, like I have seen the when I started my career, TCO people, they don't used to calculate the TCO on the whatever you're going to buy. So generally now, people have started calculating or hospitals have started calculating the TCO on the equipment part, which is very common. And earlier, if you see the base cost, we used to see, we don't see the consumable cost, which is going to the equipment, and other costs like AMC, CMC cost is going to be held, and what is the life cycle of the equipment is claimed by the company, and what is the downtime. So that TCO was not calculated earlier. Now coming to the another part of the TCO, which is hardly people are calculating in healthcare industry. Girja madam is sitting here, like we are going for the any cannula, changing from the MNC to the Indian company, and we have seen the cost only, but we don't see how many times nurses has to prick, what is the wastage of the blood is going on, or maybe the life of the cannula has been done. So that kind of TCO calculation has to be done before implementing of this kind of product. Similarly, paper tape. Paper tape is there. If you do the sample testing of the 10 patient, it is very good. One day you will get a complaint, patient is getting the skin peeling, patient get a skin issue. That can be the problem is there. But those kind of TCO calculation, there is no formula, there is no calculation is there in the market right now. But manually people are doing, some of the hospitals are doing. And that TCO is really helpful in the patient care, or you can say the management of the nursing care and cost management also to the hospital. Thank you.
Thank you. Thank you, dear. See, the continuity of the patient care largely depends on that how well our supply chain management system has been executed or framed. So, Vikas, since you are heading up a large operations, wanted to understand that what are the key operational lessons in recent years that you had learned in terms of day-to-day operational, how you had overcome those problems in terms of your supply chain management?
Yeah, good afternoon all. So myself Vikas from Fortis Hospital, Gurgaon. So if we see in a supply chain, just I take a 1 minute. So supply chain, why is important? Why we are discussing here in every panel, in every healthcare scenarios or conferences, we have a supply chain management as a topic for discussion. If we see in a healthcare, in a cost, the second largest cost center is the supply chain. So after the HR, all the money which is spent by the hospital is a supply chain. And if we add the services and capex, it is more than the HR budget as well. So that's why it's very important for the hospitals and healthcare. They have a very effective and efficient supply chain system in the hospital. For a hospital, a large operations, which is a multi-specialty hospital, we're very high-handed. Future care hospital, which we claim as a FMRI in our hospital, because we are treating a lot of international, national, domestics, and the bureaucrat patients as well over there. So if we see, if for a supply chain person, there's a various stakeholders are involved in that. Like doctors, they need a preferred choices. What the brand they choices, we have to make the available. My healthcare providers like nurses, technicians, they need a continuous supplies of material. If some unplanned cases has come in, they also need the material. The supply chain person can't say no to them at that time. So they need a continuity of the material. My insurance payers need the clarity, transparency of the bills. Whatever we are charged, that has to be 100% sacrosanct, correct in that over there. My suppliers, vendors, partners, what they need a time. When they come to the hospitals, we give that sufficient time to them and discuss and understand their products and give the orders in lieu whatever we have a consumption in the hospitals. And last, the management, they need a profits, they need a margins. How we can bring down the cost and increase the patient prices or the drugs and consumables, how we can increase the earning for the hospitals over there. So these are the various stakeholders that the supply chain has to manage over there. So for the efficient supply chain, which has to be run 24/7 in the hospitals, the challenges which we have seen last 5 years after the COVID, first is we can't depend upon a single source. We have to have a multiple source. So we have a mindset to buy from a L1. Who is the lowest one? We have to buy for that. So we have to drop from supply chain point of view that idea, because penny was pound foolishness is not a concept right now over there. We have to look forward for the partnership. We have a multiple sources, multiple quality check, and like Rakesh has said for the TCO. So for calculating the TCO for each and every item, besides the cost benefit analysis, we have to do the cost effective analysis also. That's why my nurses, technicians, the patient, they also get a benefit what the products we are buying for the hospital. So we have to do the TCO for the each and every item. We have to multiple sourcing. We should not go for the procurement. We go for the long-term partnership with the suppliers. We help them to innovate because the companies have a research budget. They are doing a lot of innovation for our hospital healthcare setup over there. We have to do the partnership. We offer them our hospitals so that we can become the first choices to use their products as the evaluation centers for our supply chain. That benefits for my technicians, for doctors, as well as for the patients as well. And the last, if we can involve my clinicians, my users, what the product they need, because they are the ultimate users. They are using these products for giving the patient care. So involvement of my clinicians, doctors, users, healthcare providers is very much important to get the right product for the hospital at the right time, at the right price.
Just wanted to understand from you, see, your kind of a scenario is entirely different. The doctors, nurses, or the other administrators, when they feel, they just come to the procurement. And in last minute, they'll come up. They don't understand the whole process which works behind. So how you generally deal with such kind of the situations? I'll come down to the group heads, but since you're heading a unit, I wanted to understand from that.
So it's a common phenomena because the persons who are not from the supply chain point of view, like doctors especially, technician, nurses, OT team, my ICU team, they doesn't know the processes. Because we have a lot of approval matrices, selection processes, compliances before getting onboarding the materials over there. So for that, if we have a pre-involvement for the discussions, whenever the doctors are joining to the hospitals, if the supply chain persons know, if new programs which we are offering for the hospitals, new machines, new equipment we are buying, new program we are set up, if we involve the supply chain team at the front end, then they can discuss all the products, what the instruments are required, what the consumables are required, what the drugs of preferred choices for that surgeon is required, so that we can mitigate the last chances of the crisis in the hospital. Secondly, we have to, like these are the common forum where we are discussing and sharing our challenges, so we have to present with the data to our clinicians, doctors, the process as well. Because this is not process we are working in a silos. These giving the compliancy and regulatory compliances to the hospital, safeguarding from the audited and the government regulations, as well as saving the money for the hospitals. So they have to also understand this process and support the supply chain team administration to follow the same.
Great, thank you. Mr. Vijay, we had understood from them in terms of the hospital, the process, systems, how challenging that is. From a manufacturer point of view, from an industry perspective, what do you feel in terms of that the way the healthcare system is evolving, that how as a manufacturer you see this, and at the same time would like to understand this next gen disinfection, which is how it is going to be helpful for the hospital?
Thank you. I'm Vijay Kumar Gupta from Hyderabad. We are a semiconductor company, and very recently we stepped into healthcare sector thanks to one product where we are trying to leverage the spectrum of the LED lighting. We are manufacturers of LEDs for the last 35 years and been able to use LEDs. After the invention of LEDs, we were able to get individual single spectrum. Otherwise, from normal light, you have to filter it out any wavelength is very difficult. But every wavelength has its own applications, and then we are now able to exploit every wavelength in the LED itself. And coming to, say, as a manufacturer, now it becomes my duty where the benefits of the light spectrum, because that's my specialty, try to apply them to the healthcare sector. And obviously, the procurement team in the company, in the hospitals, there will be a forefront. And they are sufficiently empowered and represented at the highest levels so that they can also create opinion, they can scout for new technologies which will ultimately solve the pain problem. And one of the pain problem is infections. Everybody who has got disease, he first heads to the hospital. So hospitals is a convergence of the maximum amount of per unit load of infections there. And then this becomes a big nightmare for the hospitals to manage that. And at some places, like applications like, though in OT or in the operation theaters, you have technology called ultraviolet light, and you have got fumigation, which they regularly do. But what about the ICU? Anybody who stays in ICU for more than 4 days comes out with a new infection, because doctors are hand-tied. They just can't do anything because they can't use either UV or any fumigation processes. Yeah, they do take a lot of care to clean up the local surfaces, but then that's not enough. Somebody next to your bed is breathing out infection like TB or anything. Before it goes over to the exhaust and then goes into the HVAC system, gets filtered through HEPA filters and come back, it is going to affect quite a few number of people. So there is, that's why we have something called nosocomial infections, called hospital-acquired infections. But there is a technology now which can be applied. It's using visible light. You can also disinfect this thing. So later I'll be coming back to that. Thank you.
Thank you, Mr. Vijay, for this new concept that you had shared. Nandini, the large hospital networks benefit from the scale of purchase, but at the same time, understanding the geography, understanding the need at the different places. So how you make the right balance, how that works out?
So I see it is very important to understand when and how to take the advantage of economies of scale. Because if you see an hospital environment, then basically it is very localized. Clinically also and operationally also. It is very localized. To say that we have a centralized supply chain will become a little bit a misnomer on a thing to say that our supply chain is centralized, but our operations and clinicians and clinically we are decentralized. So basically, I think we have to strike a balance as to what all we need to centralize and where to leave it in a decentralized fashion. So I think the underlying theme is basically what we need to centralize, with whom we need to centralize, but when we need to decentralize. So if anything, the what is basically in Fortis, like we have able to, with the involvement of our clinicians, our clinical operations group, we have been able to involve them and get to a formulary where now most of our clinicians are aligned. So that is the what. So we can say ki what to be used and how to use that economy of scale, how to bring in financial discipline in that what. Second is the whom, like which are the manufacturers, which are the suppliers. Those things also can be centralized at a point. But when is it required, how it will be used, where it needs to be given at what point in time, that portion has to be decentralized. So it is very important how we look at this group supply chain versus a unit supply chain. I think because both of them are equally important. If you see supply chain, I have been in this field for a lot of years. Basically, supply chain is invisible. In COVID, I think people started realizing that there is a supply chain, because if there is no supply chain, things got stuck at some level. And now supply chain, I think, needs to also move into the forefront. So there are a few things which, and we have been in Fortis, I think at some level that which portion to centralize, where to decentralize, but I still think that a lot of dialogue with the operational people, clinicians, with the local supply chain team, central supply chain teams, I think that also brings in a lot of clarity. And also if you have a clarity on the decision making, that people in the hospital, if they're clear which decision lies where. So if a decision has to be taken at a central level, people at the unit should be very clear that this decision lies at the central level or at the group level, and which decision lies at the local decentralized level. So I think that also helps to bring a lot of clarity in centralization versus decentralized systems.
Thanks, Nandini, for that. Yeah.
Just to add in that, in a nutshell, if we say, so our strategy should be centralized and execution should be unit-wise or operationally. And the benefit of that is that one, because in a supply chain, we have to follow a lot of regulatory compliances. So if we do the strategy centralized, so we can due diligence centrally. My vendor, supplier, we can onboarding on centrally. We can do the negotiations, rate contract, service level agreements centrally, and then execute it at the unit level. That's why in Fortis also we have a formulary system where the corporate is doing the rate contract with the various brands of the drugs manufacturers, even various service providers who are providing the manpower and giving the choices to the unit. They have to choose which one is the best out of them for working for them in their unit, in their region, and then explore the same.
So today being the 31st, you had reminded us for the salary, huh? That's the...
That's already credit.
That's how the
That's already credit for all of us.
Okay. Rakesh, just wanted to understand, since your operation is also largely into different parts of the country, so how you see this supply chain management in terms of centralized as well as the decentralized?
So first of all, I would like to add one thing. This Amazon, Swiggy, these people have made our life very, like, you'll say, difficult for us. The reason behind it, people, whenever you're talking to any user, अरे तुम 5 दिन लगाते हो, मैं अभी order करूँगा 10 मिनट में आ जाएगा. So that's the worst part has become for us, and this kind of example has been given by the peers, you can say leaders, and sitting by other people. But they don't know the process, how to get the approval and this. Now coming to the centralized part and all this. So like there are the examples, I'll start with the example like manpower, third-party manpower, we are taking ward-based house. You can negotiate it centrally, but you can't get the manpower from the central vendor. That vendor should have the presence in all the location where you are having, or you have to go to the local vendor. Similarly, I'm talking about the non-medical, then I'll come to the medical part. Similarly, you can go for the laundry vendors and other kind of these vendors. Centrally, you can negotiate, but you have to see the practical ground at what is there at the ground. Maybe you have negotiated with the X company, which is giving the supply pan-India. But pan area, their distributor will not supply with a limited amount. Minimum MOQ is there, or maybe they need some kind of order value. This kind of pain we have to see before going for the centralization. As Nanni said, we have to mark a line which item has to be centralized, which should not be centralized, and how to negotiate. And third, which is like we all are Fortisian, I'm ex-Fortisian, and other people are Fortisian. I'll call this panel as a Fortis panel. Okay, so we have learned from that, you can negotiate from the centrally, but some power has to give into that local level also. So that item-wise, or we can say facility-wise, or division-wise, or need-wise, you have to mark the line, which has to do the centralized or decentralized.
So, Mr. Vijay, as government is also supporting a lot of indigenous initiatives, so as a manufacturer, what do you feel? What are the challenges in terms of the quality and how the market is perceiving that? And similar way, I'm going to ask them also that how they are perceiving the Indian products also. So what's your view on that?
Right. I think the government has very rightly started looking at how to make India Atmanirbhar and then develop all the technologies and the products here. And one is trying to indigenize the existing products developments which are happening there. Many medical technology parks have come up. You have AMTZ and many other things. Even we have something in Hyderabad, again medical technology similar are there. And they are all trying to, like cell phone, where you are gradually working out to keep value adding. These companies are also trying to do that. They basically import the basic working part and then start assembling them and then testing them. But the biggest plus point is you have somebody locally available to maintain the system at the beck and call. That's a very big thing. Otherwise, if you're a foreign system or any system from anywhere, it's very tough. We do use many Chinese equipment in our semiconductor manufacturing clean rooms facility, automatic systems. But it's sometimes it becomes a problem to maintain them. But the main thing is the technologies are evolving and is getting recognized as a startup through incubators and other things. The support is really tremendous, especially in the medical field, like in lighting with LED technology. You have now available UVC rays, you have got UVB, you have UVA and infrared light. And then like UVB, now we are talking about D vitamin deficiency all over India. everybody is that. But UVBs are the rays which are available through the sunlight during midday, that is from between 10 a.m. to 3 a.m. If you are going out in the sun for walking in the morning, 9 o'clock, you don't get any UVB ray, it gets absorbed. So many people don't talk about it, they say go to sunlight, you get that. But if you have a booth which has this light, LEDs giving you that light, 15 minutes, half an hour exposure will give you your daily quota without hampering with your whole biological system of medical equipment. So any medicine has a side effects which affect some people more, some people less. So this is something which is external. Similarly, now that we have something called visible light disinfection, there is a wavelength which is very close to the violet end, and basically, you can hear me? Yeah.
Yeah, yeah.
This wavelength is known for last 2 decades. Working?
You can take this one.
This visible light has been tried on every known pathogen over last 2 decades, and it works very well. Only thing is, there is no source available for that till today. Because we make the LED chip, we have expanded the white LED chip to add this particular wavelength, and this wavelength is so tuned to the endogenous porphyrins in the bacteria, and it knocks off one oxygen from there, a ROS, reactive oxide species, is created, which kill the same bacteria. Fortunately, that porphyrins or similar compound is not there on a human skin or on the mammals, so it doesn't affect our skin, but it only affects selectively the bacteria. So it's a God's gift to us, and it's time for us to exploit that. And we were able to, but making it into one single chip with that wavelength spectrum control was difficult. We were able to manage that. We got the patent, and now it's a reality. It becomes easy. You just change your normal light into this. It's the simplest most thing. You simply take out your light, normal light, and put this light, and then for 5 years, this will last for that long, and keep the whole place sterile. It removes the bacteria in the air, and that air, it doesn't remain there. It goes under your table, behind the chair, behind the cot, behind the instruments, and then it brings out the germs, and they get killed. And after 2 days, 3 days, 4 days, every small crevice in your wall, or in the furniture, or in the equipment, is also clean of bacteria. And thereafter, the issue is only incremental bacteria which comes in. That is, people who breathe out something, then it gets killed. And so you have an excellent method of keeping the whole hospital waiting areas. People go to doctor with a infection. How is the doctor getting protected? Only through his own immunity. But if you have this particular light, one in each of the cabin of the doctor, then the doctor is protected throughout the day, and he can work with much more. Similarly, for surgical site infections, the surgeon is very, very careful, stressful, and he cleans up the wound area very well, and then he sterilizes the equipment, and he can take care of a lot of things. But the whole environment, between the two fumigations, there is the bacteria microbial load goes very exponentially high, and there's nothing he can do about that.
So
but
we'll
if you have these kind of
time
lights there,
sensitivity.
it will be very useful. Right? So this technology, and these are things which probably procurement agencies should be able to target and then do it, basically.
Great. So Mr. Vijay has actually mentioned about that how cost effective, or from a hospital point of view, that how cost saving can be done. Now, in terms of the supply chain management, the biggest KRA for supply chain management is maintaining the availability, continuity, the cost effectiveness. So how you are maintaining those options in terms of technology, in terms of when you have a lot of options which are available as the Indian products, which can have, from a availability point of view or from a continuity point of view, those can be maintained. So this question is for all three of you. You can pick up, and you must have the different views on that. So how you wanted to answer on this? Because there are a lot of stalls which are of the Indian companies. So how you look for their future in terms of the hospital?
So see, I think strategically for supply chain, if you see, so the local manufacturers or Make in India program will and is going to prove a game changer, is what I think. Because as you rightly put it, the healthcare industry is under a lot of burden to reduce the overall cost of delivery. And supply chain plays a very big role in it, because as Vikas also said, that if you see each and everything in an hospital comes through the supply chain only. So I think the local manufacturers, they bring in, you can say, whatever the variabilities there are in import related variabilities, forex currency related variabilities, which actually will help to reduce the price. I think the most important thing would be that how they are able to compete with the global manufacturers, what certifications they are able to get, what kind of research and development they bring into their own items and equipments and probably consumables. I know pharma for us is very well advanced. Most of our the pharma drugs which we use are manufactured in India, not so much in the other spheres where we have consumables, probably equipments. Those we need more influx of local manufacturers, which can reduce the variability for the entire healthcare system and probably bring down the overall cost of delivery.
Great, thank you.
Yeah.
Yes, Rakesh.
So I'll add in that. First of all, in India, Make in India, post-COVID, we found the importance of the Make in India products. We had faced a lot of challenge during the COVID, and government is also pressurizing to the even the manufacturing MNCs company to establish their manufacturing plants in India. If you'll go to the studies from Hyderabad, I'm also stationed in Hyderabad. So we'll see there's so many Philips, Siemens, and all these people are coming to establish their manufacturing plant in India. Now, coming to the manufacturing.
The panelists will be available. Post to this discussion, we can